everybody, it's Dr. Barb, Holistic Veterinarian here. It is Tuesday, August 25th, 2020, and I want to give you a little bit of food for thought because this has been something that's been on my mind for quite a long time. And I'm going to start by asking you two questions. The first one is, who owns your body? And the second one is, who owns your animal's body? Now, it might seem a little weird, but stick with me. It'll make sense here in a second. Okay, so I hear a lot of people saying like, well, my doctor told me so I'm going to do it. And I see too many people with pets or other animals. Well, my veterinarian recommended that. I think they know best, so I didn't question what was on the reminder card. I just did it. I'm sorry, but right then and there, in either scenario that I just mentioned, you're giving power away to a medical professional who really doesn't know you or who really doesn't know your animals. And you might argue with me and say, well, I've been going to the same doctor for 30 years. We have a really good relationship. I'm sure you would after 30 years. But in a 15-minute medical appointment where things are rushed, many things like nutrition, other schedules, your exercise routine, things just aren't discussed. And furthermore, your doctor might know you physically because he's been seeing you for 30 years. But does he or she really know you as a spiritual person? Meaning, that person can't really know you, your goals, your lifelong dreams, your everyday struggles emotionally and mentally. I mean, we all have them. He doesn't know, usually he or she doesn't know the stress level. She or he may not know what really is eating at you and why you're sick, because we all know, I mean, it's been documented scientifically that if you have trapped emotions, if you have things that have been repressed psychologically and not brought out and dealt with, that can lead to actual physical disease. So same thing with your pet. You might have brought Fifi in as a puppy and had your veterinarian check Fifi over and gave her first shots, dewormed her, talked about all this heartworm and flea and tick control, that kind of thing. And then Fifi would come in every year for her annual vaccines and checkup and any other things that need to be done, like a heartworm test. And unless Fifi was sick, your veterinarian would only see Fifi once a year. So when we think about animals and the parallel it is to humans, as far as what I just mentioned with the humans, as far as the emotional, psychological aspect, our animals are no different. They have feelings. They can think, and I'll tell you a little story about thinking in a minute. They have a lot of emotions: joy, happiness, fear, anger, just like humans do. Only we try to poo-poo it because they're just animals, right? No, they're not just animals. They're little spiritual beings just like we are. But with all that said, when we give our power away when we tell our doctor, yeah, it's up to you. I don't have any say in my body. Yeah, it's all up to you because you're the expert. Or if you take your animal in and you say, well, they know best. I'm sure that all these things on the reminder card are things that Fifi needs. Well, I'm going to tell you a little story. Let me go back to thinking before I forget that. So a lot of people tell me, well, they're just animals. They don't really think or have feelings or emotions. Their feelings don't get hurt. I'll tell you, I have a horse. He's now 32 and a half years old. Now, you say animals can't reason and can't think. Okay, so he was housed in this little paddock, a little pasture. It was actually an old apple orchard, so there were a couple of apple trees that were still producing in there. And at the end of the year, the apples were kind of at the top of the tree, and one occasionally would fall off, and Pal would go get it. Well, one morning, because that little enclosure was just outside our bedroom window, we heard this whap, and then boom, 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 boom. Whap, boom, boom. And here was Pal kicking the apple tree, the trunk of the tree, to get the apples to fall. I mean, who taught him that? He knew how to do that. First of all, we caught him butt slamming the tree. Like he's a big quarter horse gelding, so he would just come and push his butt into the tree and kind of hit it hard enough where a couple apples would fall off. And if they didn't fall off, then he'd start kicking the trunk. It's the funniest thing I'd ever seen, because I also thought animals couldn't reason. But he knew a technique to get those apples off there. So go figure. Oh, wow. Animals are funny. But going back to what I said, when we give power away, when we say, here we are, we trust you, you're going to do the best, you know us better than we do. That's baloney. People who are really in tune with their bodies know when something is wrong, and usually don't wait to go to their doctor to get it checked out. Or they'll be proactive in doing things like I do, all natural things as much as I can. Now, I'm not saying I never use conventional medicine on my animal patients. Personally, I have not taken a prescription or an over-the-counter medication. I think I took one Benadryl maybe 3 or 4 years ago when I got into some mold in the basement. And I was coughing like crazy and sneezing and everything. But that's the only over-the-counter medication I've taken in 13 years. I'm not taking any prescription medications. That is my choice. I choose not to. And actually, I don't need to, because I'm healthy enough now. But I'm all over the place here because my brain goes a lot faster than my mouth. So stick with me, okay? I had cancer in 2007. I was diagnosed with a very aggressive breast tumor. I went in April for my annual medical checkup. Everything tested fine. And 4 weeks later, there was a 2 centimeter, about an inch long, or inch in diameter mass in my right breast. I tell you, that was the scariest day of my life. And I'm going to make this story short, because I could do an entire video on my cancer story, but I'm not going to go there today. This is how I got into holistic medicine, though, because I knew I had a lot of health issues, including fibromyalgia, severe allergies when I was in the emergency room several times in anaphylactic shock. I had acid reflux for probably 25, 30 years prior to that. I also had asthma and skin issues. So I was kind of a mess, but I just thought, well, I'm aging. I was 50 at the time of my diagnosis, and I figured, these things come along with aging. Wow, was I wrong. So anyway, I was more scared of going through conventional treatment for the cancer than I was actually having the cancer itself. So I started researching everything I could. And I will tell you, I did have a lumpectomy. That was the only conventional treatment that I had. So that's surgery to just go and remove the lump itself. No other tissue, no lymph nodes, just that. And thank goodness, because I had gone to a healer a couple weeks before my surgery, and she had actually asked spirit to God. I love God. God, spirit, whatever word fits for you, to bring the cancer cells together so that he could remove everything. And there was just one margin when they do like an in-surgical type of biopsy to see if they've gotten everything. They never get everything, you know that. But there was one margin that was a little thin, so he ended up taking a little more tissue. But because I was so blessed The cancer had not spread to my lymph nodes, so I'm still here today. But my journey was amazing. My mom had died from uterine cancer 4 years prior to my diagnosis, and I watched her go through experimental things down at the University of Iowa hospitals. She was also told she would live 18 to 24 months with treatment. She died 2 days before her 18th month. So the brain picks up and processes what it hears. And if you don't stop it in its tracks, if I had bought into the fact that the surgeon that I met with said I had to go through radiation, I had to go through chemotherapy, I had to have, he didn't say I had to have the mastectomy, that was up to me. I chose not to have the mastectomy. I chose just to have the lump removed. But here's what I had to do. I had to decrease my stress level. I was in a high stress job. Veterinarians, let me just put it this way, veterinarians have one of the highest suicide rates of any of the professional people, because it's a very stressful job. You don't make the money that you need to. I mean, we're doctors, and we make a fraction of what a physician would make. So there's the stress. There's the people, the animals that can't talk to you and how they feel. There are clients that are upset because their animal isn't getting better. I mean, the stress level is incredible. So I had to get out of that job and do something that was more rewarding, and that's to come. I mean, it's already happened, but it was part of my waking up and finding out that there are other ways of treating animals. So anyway, that and changing my diet, I was pretty cognizant of what I ate, but I really had to clean it up even more and go as organic as I possibly could. I increased my exercise routine. I was a runner. I don't run anymore just because I'm 63 now and power walking fits better. But I also was involved in essential oils. I was a large animal veterinarian, had brought me on board with an essential oil company that has therapeutic grade essential oils, started using those, herbal supplements, homeopathics, and I didn't do acupuncture, chiropractic, and then energy work in the form of photon light therapy, which is really, really cool. So all of these things brought balance back into my body. And people say, well, did it work? I'm like, well, I'm still here, right? I didn't go through chemo and radiation. I'm still here. So anyway, I refused to give my power away to the medical profession. I did not want to go through the conventional treatment. But God directed me to these other practitioners, and it's been a tremendous learning experience. Now, going back to the veterinary side of this, let's just take this scenario that you got the reminder card that Fifi needs XYZ plus ABC and everything else under the sun. Let's pretend Fifi is now Fluffy, and Fluffy is an indoor kitty, and it's recommended that Fluffy's going to need the leukemia vaccine, feline leukemia vaccine, and an intranasal bordetella shot, which is a nasal drop that goes and it's supposed to treat or prevent feline kennel cough. And I don't even know if there's even such a disease as feline kennel cough, but they say there is. So anyway, if you've got an indoor kitty that never goes outside, Fluffy never goes outside, okay? Let's just pretend. And Fluffy never comes in contact with another kitty, maybe a housemate that doesn't go outside. Why would Fluffy need the leukemia and the intranasal bordetella vaccines? She doesn't. But here's what happens. Maybe I've already said this, so I will review this before I post this. Veterinary clinics need revenue. They're not subsidized. They don't get grants like the medical profession does. And so if I owned a practice, If I owned a practice, I would be responsible for purchasing my own digital x-ray machine, ultrasound, blood machines, any other equipment that I need, surgical suite, I mean, we're talking thousands and thousands and thousands of dollars. That veterinary clinic has to recap that income. They're taking out loans, unless somebody came into a lot of wealth, which doesn't happen with veterinarians very often. But you see what I'm saying, is that the revenue has to be there. So you may be advised to do things that your animal doesn't need and that may be detrimental to them. If you've got a dog and you live in the northern United States, like I'm in northeast Iowa, and it gets cold in the wintertime. December is 25 degrees on the average, I think, and then January is 15 degrees for the high on the average. And we get down into the below zero numbers frequently in the wintertime. If you know that heartworm is carried by mosquitoes, the little larvae that get injected into your dog's body through these mosquito bites, mosquitoes don't exist in Iowa or the Midwest, the upper Midwest in the wintertime. Now, if you're down south, mosquitoes are there all the time. But why would anybody in the upper Midwest give their dog heartworm prevention 12 months of the year? Or why are they on flea and tick products all year long? Some clinics, not all of them, but some clinics recommend this. It's for the revenue. And there might be a few practitioners out there that think, well, you know, it might get up to 50 degrees in December, and that's happened before, and we could have a little mosquito outbreak. I still think that if you're doing heartworm prevention for dogs in the wintertime, when it is consistently cold, you're overkill. And now they've come out with these studies on ivermectin and different organ system problems like eye health. They're talking about different eye conditions that are coming into light because people are giving ivermectin products and it's destroying certain structures in the eye. And now there's a 3-month flea and tick pill. It's been out for a couple years. And there used to be a Facebook page called, I'm not going to mention the company's name, you can do your own research, but I'm just going to say X company. X company's product killed my dog. And there are hundreds and thousands of people who have posted there saying their dog got extremely sick and or died within 24 to 48 hours of this flea and tick pill. Now, there may be some coincidences, and who knows? Nobody can prove this because there's not been any studies done on it. But the correlation is there. I remember when I worked at another clinic, probably about 10 years ago, this lady would bring her dog in, and the dog would be, it was a mixed breed dog, to be deathly sick, vomiting and diarrhea, couldn't eat anything for days after she applied Frontline. Now, we were always told as from the sales reps that Frontline is not absorbed into the system and it stays in the top 3 layers of the skin. Why were this dog's liver enzymes elevated after Frontline application if it doesn't get into the skin? And a week later, the enzymes will be normal. About 3 times of this, I told this owner, I said, do not use this topical product anymore. Obviously, it's affecting your dog, and she totally agreed with me. And once we quit using that topical flea tick product, she never had another vomiting issue. The liver enzymes were totally normal after that. So you have to be discretionary as a pet parent, as a horse owner. Don't just take it for face value that somebody says this is safe. Do your own research, but you got to dig deep. A lot of this information is censored and hidden from you. And it's been a journey. But again, going back to my original 2 questions, who owns you? Who really knows you? Only you know you. I mean, seriously. You live with yourself every single second of every single minute of every single day. You know your animals better than any medical professional out there. If your doctor or your veterinarian won't listen to you, find another one. Find somebody who will take the time to get to know you, to answer your questions, to dig deep with you. Because it's putting your best interest and your animal's best interest in mind that provides the health and full healing. Okay, guys, this is a little bit of a rant today. I went longer than I thought. Thanks for hanging in with me, and please visit my website. It is Barb Fox, DVM, like Doctor Veterinary Medicine.com. It's barbfoxdvm.com. I've got some great online courses for pets. And if you want to follow me on Facebook, my Facebook professional page is Natural Animal Health Movement. So don't have to join a group, just have to like the page. Please do that. And thank you. I love you all.